Hello, my name is Isabella Diaz, and I worked in Dr. Hayes' lab in UT Dallas during my time in LSAMP. I worked on a project called vagus nerve stimulation may show signs of improvement in bladder controls. Now let me give you some background. Lower urinary tract dysfunctions, LUTD, is a major medical concern for people with spinal cord injury, SCI, and it interferes with the relay of information between the bladder and other micturition centers through the damaged spinal cord. We used vagus nerve stimulation to release neuromodulators paired with neural activity to invoke neuroplasticity, which leads to improving recovery. This study is in the preclinical stage where we pair VNS with the voiding phase of the bladder cycle during continuous filling cystometry, which could lead to a change in void volumes and overall bladder activity. Now, we did use adult female spayed dolly rats, which underwent urodynamic assessments where they were stimulated in the vagus nerve to possibly condition bladder micturition reflexes in the rats. The sham group received no VNS and served as a control group. This group underwent daily catheterization and subsequent UD sessions for 4 weeks, while the VNS group received the same, but with their vagus nerve stimulated. Figure 4 and 5 data graphs did show changes in bladder pressure in response to voiding and the storing phases of the micturition through therapy, and they have been improving. Now let me go into depth about the micturition cycle. In healthy rats, there is an uninterrupted communication between the micturition centers in the brain and the urinary system, and since the spinal cord is intact, then there is a smooth passage of signals between these two centers, and this allows for the healthy control of the bladder, which initiates filling and voiding whenever necessary. So when it comes up to the bladder, the urinary sphincter contracts while the diastolic muscle in the bladder wall relaxes, and this helps with the storing of the urine in the bladder. However, when the bladder fills up and there is a need to initiate a void, which in simpler terms is urination, the urinary sphincter opens up and the diastolic muscle, which lines up with the bladder wall, begins to contract, and this pushes the urine out of the urethra. However, when you do have a spinal cord injury at a level which impacts the bladder function, then you have an interference in the communication between the micturition centers in the brain and the urinary system, and this interferes with the communication, which could lead to alleviate any symptoms, which are urinary incontinence and urinary retention. With this, you have issues with filling and emptying the bladder. In conclusion, instead of focusing on restoring the communication and disrupted pathways, we use a targeted neuroplasticity via vagus nerve stimulation paired with a micturition cycle to enhance the pathways that are left after a spinal cord injury in order to restore the communication between the micturition centers in the brain and the urinary system. A possible direction in the future is using VNS and rehabilitation to treat lower urinary tract dysfunctions with patients who have spinal cord injury. Thank you.